Hey guys, welcome to the Dr. Carter Vet podcast. Today we're doing a remake on the heartworm disease talk. We did the first heartworm disease talk, but the audio wasn't the best, so we're doing a remake. So let's start. What is heartworm? Heartworm disease is caused by a worm called Diarrhea immitis. That's canine heartworm disease, and it's a worm that lives in the hearts of dogs. Yes, it lives in the heart of a dog, lives in the bloodstream. How would your dog get heartworms? Heartworms is usually transmitted by mosquito. Mosquito is a vector of heartworm disease. A mosquito would bite an infected dog. It gets the heartworm larva and it transmits it to another dog. So heartworms now, as most worms may lay eggs, heartworms what you make live young. So it's called viviparous, which means its reproductive method would be to send out a live young instead of an egg. Now, if you know about GI parasites, we will do a talk on them eventually. You know that most GI parasites are fecal oral transmission. So they're in the guts, they would lay an egg which would come out in the feces, mature into a larva, maybe 4 second or third stage larva, and then somehow get back for the animal to eat it. Now, heartworms being in the bloodstream has to find a way to get in the bloodstream. So it releases a live young. This live young circulates the bloodstream, probably gets stuck in a capillary or somewhere. When a mosquito come to drink blood, it gets the live larva. The larva, I think, does mature in the mosquito. And when the mosquito goes after another dog, it would transmit the heartworm infection. Now, mosquitoes are indiscriminate as to what they bite, so then cats can also get canine heartworms. We've seen other animals such as seals with canine heartworms, and human may be exposed to canine heartworm larva, but the heartworm disease cannot take hold in human beings as of the point of this podcast. If you're asking if the mosquito bite my dog, can it transmit the heartworm larva to me? It can, but your spleen should clean that up. Anyway, let's talk about heartworm. So heartworm is sort of 100% preventable. It could be avoided. It's been around for a while. It's been known for a while. So there is so much different preventative methods that could work. Some have monthly tablets. Some have tri-monthly, bi-monthly. There is even new stuff that can last 6 months to a year. One injection stays 6 months to a year in your dog. So there's no reason really for your dog to transmit heartworm. Heartworm is also geographically specific. It is a disease for sort of tropical and subtropical areas where there's lots of mosquitoes. It would not survive the temperate regions because mosquitoes would die out over the winter. But if you had a dog with heartworms and you brought it in the snow and it's inside for the whole winter, it may still maintain the infection. But then just use a preventative. um, the ivermectin family of medication is very effective against heartworm. So that's like the ivermectins, the moxidectins, the doramectins, almost anything with a mectin in it. Actually, ivermectin would be the number one drug of choice for heartworm prevention. You have mainstream commercial products like HeartGuard. You have other tablets like Endolav Plus. That's just the name of two things that exist at the point of this podcast. You can also do injections. Some people do oral ivermectin. Some people do injectable. The reason why it's so good, ivermectin usually stay in the body for 28 days. So it's a good monthly preventative. You do it once per month and you sort it out. There's other things that like the new Pro Hat products and stuff that would last 6 months and a year in your dog. So you can also choose this as a heartworm preventative method. As I said before, prevention is 100% effective. However, curing can be tricky. So, before talking about curing, now we talk about how you diagnose heartworms. There's a few ways to diagnose heartworms. You can do it in a post-mortem actually, which comes out to be one of the most common ways to diagnose heartworms in the subtropics. Or you can do a blood test. We're going to talk about the blood test first, then we talk about you can take any venous blood. You can even take arterial blood, but venous blood is the best choice. You put it in one of those ELISA tests. Some are snap tests, some is just you put it in a little thing. These tests normally test for multiple things because if your dog gonna have heartworm, which means it's not a heartworm preventative, it most likely was not an flea and tick preventative. So you test for heartworms, usually Ehrlichia and Lyme disease, which are tick-borne infections that normally comes along with a heartworm infection because, as I said, if your dog is not on heartworm preventative, it's most likely not on flea and tick preventative. Um, Usually see one time that it's a test that take 8 to 10 minutes. You can do it at the owner's place. You can do it at a veterinary clinic. You can do it anyway. 2, 3 drops of blood. You put in a reagent, and then you see if you have a positive dog or not. The other thing you can do if you don't have those tests or you're not privy to that, you can actually take some capillary blood if you have a microscope and you look at capillary blood under the microscope and you may see a heartworm larva in there. Now, if you're doing it that way, the lack of a larva does not mean your dog does not have a heartworm infection. You can actually go off the symptoms. Number one clinical sign for heartworm would be a coughing dog. So your dog is coughing, you have not been on heartworm preventative, you live in an area prone with mosquitoes, your dog most likely would have heartworm infection. There are other causes of cough in dogs, but if all these things line up together, heartworm would be a number one rule out. So the common clinical signs would be coughing, exercise intolerance, meaning the dog can't even run down the step and back without breathing hard, struggling to breathe. Sudden death is actually a clinical sign. Your dog ran down the street, he came back up, it fell over and died. Now, when it's sudden death, of course, you can diagnose in the postmortem. And what you would see is a bunch of worms living in the heart. Because it's heartworm disease. They live in the heart. They actually live in the right side of the heart. So one of the ways you can do an X-ray on your dog chest and you would see the heart looks like a reverse D instead of the normal heart shape. When you get that, then you know, okay, well, if it's a reverse D, it's coughing, exercise intolerance, it's possibly a heartworm infection, yeah? And you can treat it. Now, treatment itself is a risk because based on the severity of the dog and the heartworm infection, um, my heart might be overrun with worms. So when you're treating, you have to worry about if the worm dislodge and go somewhere. Dead worm could go to the brain, cause a stroke. Dead worm could go to the coronary arteries, cause a heart attack, go and block one of the arteries or the veins to the leg, cause some kind of problems. So when you're starting treatment, you have a risk in the early part of treatment to also cause secondary damage to the dog as a result of dislodged dead worms. So it's always recommended they normally put the dog on a steroid or something anti-inflammatory. They would also put the dog on cage rest and limited movement because you don't want anything bad to happen, but the risk is there that on treatment your dog could die if it's severe heart-lung disease. Another thing that would happen is if you have advanced heart-lung disease, you have what you call Caval's syndrome, where the vena cava is a bit dilated. The dog would still cough even after the treatment, so the coughing may never go back to normal. The exercise capabilities may never go back to normal, but you can extend the life of your animal. Um, so let's just talk some ground things again. We had the treatment, we had the how we identify it. Okay, in the postmortem, there are other worms that may be there. One of the cool things about heartworm is the female heartworm looks just like a regular roundworm in the GI tract, but the male heartworm has a hooked tail. It's actually really cool if you look at it well. If you're looking at it, you're probably in a postmortem of a dead animal and doing a necropsy. But the male heartworm have a hooked tail. So sometimes you actually find adult heartworms in other parts of the body because they got dislodged. Like you find like a male heartworm, one male heartworm in the abdomen, in the abdominal cavity. So that can happen at times. But heartworms generally live in the heart and stay in the bloodstream. Sometimes it can go as far as going to the lungs because they're on the right side of the heart. And if you know circulatory system, you know that the blood comes from the body, goes into the right side of the heart, goes from the right side of the heart to the lungs. And that's one of the reasons why you also have all this coughing. You can have a lot of blood going in the lungs. You have what you call pulmonary effusion. Serious breathing problems can come out of this. So, how do you recognize a heartworm dogs out there in the field? From my experience, and this is only 10 years as a veterinarian, but you normally see just a dog that's not doing right. It's losing weight, it's really skinny. Then in the morning, sometimes they only cough a little in the morning or in the evening. Some dogs will be coughing right through the day. Another way you can see it in more advanced cases where you have dogs with a big distended abdomen, and if you tap that abdomen, you get nothing but blood. I had a case once, a really cool case because it's landed right into the whole heartworm thing. Let people understand. It was an elderly couple, bless them. They had this one dog. There was an isolated community. There was not another house for maybe 5 minutes away from them. their property was fenced. It's the only dog they had, so they did not think they need any protection against parasites. And the dog was there. The dog had a giant distended abdomen, and by the time I got there, you can see how it was breathing just to walk up the step. It was coughing. I told them, okay, we're going to do the test because we can do the test on the spot. But this dog is definitely a heartworm positive dog. They said yes to the test. We did the test. Now, while I took the blood, I took literally 1 milliliter of blood from this dog, and it walked across the veranda, came over, fell over, and died on the spot. It was traumatic, but the dog was in a really bad way. It had a massively distended abdomen. The abdomen was twice the size of the dog, and I tapped the abdomen, and it was just pure blood inside of there. The test was positive, of course, for heartworm disease, and I had to explain to them that even though you're away from someone, your property is fenced, there is no other dogs around. Your dog can still catch heartworm infection because the mosquitoes can't get there. And as long as mosquito can get to you, it can get to your dog. And they had to understand that because mosquitoes can travel very far distances to get a blood meal. And yep, so that was a heartworm case. They learned. Unfortunately, the dog perished, but they did learn from that situation that, okay, bam, I need to put my dogs on heartworm preventative, even though there is no dogs around and my property is fenced. Another misconception people had was that heartworm infection can be caused by the mosquito larva in the water. So if they drink the mosquito larva, so you change the water every day for your dog, it's not going to get heartworms. Now, that is not true because heartworm infection is transmitted by the bite of a mosquito, not mosquito larva in your water if your dog drink the mosquito water. No. So that's a misconception. So as long as the mosquito can get to your dog, I always tell them, look at it like this. As long as the mosquito can get to your dog, heartworms can get to your dog. The other thing, you will need an infected dog, of course, but you do not know the dogs in your neighborhood if everybody's on preventative. If you live in a closed environment where all animals is on preventative, the likelihood is your animal would never be exposed to heartworm disease. But in the real world, that is usually not the case. Another option you do have, you can go live in the snow. You live in the snow in those cold regions where there's no mosquito, you probably won't have any ticks, you won't have any heartworm disease, you won't have to worry about these things. But if you live in the warm tropical climate or the maybe lower temperature regions, you're gonna have heartworm as a worry. And there are some areas in the world that has no heartworm cases. Heartworm preventative is not a thing. And then you may move to another place where heartworm preventative is a major issue. So if you're someone who travels with your animal a lot, you go from country to country, or you just make a big move recently, go to your veterinarian, learn the local diseases, learn what you have to worry about, what you have to vaccinate about, what you have to use as a preventative. Because in some places, Lyme disease might be your problem. In another place, heartworm is your issue. So we're going to be talking a bit more on this Dog Doctor podcast and some of the common stuff that you encounter and how to treat it, how to prevent it. So today we're talking about heartworm disease. Tomorrow we'll be talking about somewhere else. Check in every Monday for an episode of the Dog Doctor on the podcast. If you're looking at the YouTube channel, I'm going to put some video to help enhance what I'm saying. I'm going to put a couple of photos in there. But if you're listening on the YouTube podcast or Apple podcast, you're not going to see this. Just imagine a nice normal heart with some worms in it. Um, Most vets actually have it, but I'm not going to put it on the video because I don't want YouTube to ban me. But I actually have a heart full of worms in formalin there in my collection because it's something we see a lot in the tropics and in the Caribbean. Unfortunately, but everything wants to live, and so does the heartworms. So they're going to keep trying. If you haven't seen it before, a male heartworm is really cool to see with that little hook tail. But yep, that's all I have for you today on the Dr. Carter Pet podcast. It's a short one. It's the remake for the heartworm disease. Remember, heartworm is 100% preventable if you use the right preventatives. Very difficult to cure, very expensive to treat. So use a flea and tick preventative, use a heartworm preventative. There's loads of method. Talk to your local veterinarian. Talk to your Ministry of Agriculture if you don't have veterinarians in your neighborhood or community based on where you are in the world, and see what you can do. But yeah, definitely better to prevent heartworms than to have to try to treat. Thanks again for tuning into this episode of the Dog Doctor on the Dr. Carter Vet podcast here on YouTube. Subscribe to the channel if you haven't. Click that notification bell so you know when another episode is out. Hopefully, you learned something about heartworm disease today. Remember, preventative is key. Prevention, prevention, prevention. If you have a furry pet, you want them to live as long as possible so you give them the care you need. Tune in next Monday, see what the other episode would be about. I don't know as yet. It may be flea and tick. Let's see. But tune in next Monday. If you're on YouTube podcast, well, hopefully you enjoyed hearing from me today. If you're looking on the YouTube channel, I had some videos there just to keep you entertained while you listen to this. So have a good one. Thanks for tuning in. See you again next week.